Importantly, within the trial, the benefits of enzalutamide were shown for patients who did not receive corticosteroids, as well as those in whom corticosteroids were administered either on study or at the start of the trial. What is important to recognize is that corticosteroids have been part of the treatment of prostate cancer for over 4 decades. And as early as the 1970s, it was shown that administration of corticosteroids can lower serum androgen levels in patients who had progressed on surgical castration and the most effective castration at the time. What is key here is that corticosteroids in the appropriate setting have benefits, both in terms of anti-tumor effects, palliation of symptoms, and they have been used as an active comparator in phase 3 trials, both in pre- and post-chemotherapy treated patients. However, a patient whose cancer is progressing on steroids is different. And this was the objective of the study, to see if there was in fact a difference in outcome based on corticosteroid use. We looked at the group who were receiving corticosteroids, and not surprisingly, they had more advanced disease and were sicker. We then conducted what is called a multivariate analysis, trying to correct for those factors which we would say would be logically associated with inferior outcomes, such as a higher PSA, a higher LDH value, more bone metastasis, and more pain. However, even when we corrected with for these factors, we found that corticosteroid use remained a factor associated with an inferior survival, and enzalutamide also provided benefit. So the key here is the context. A patient who has not seen corticosteroids can receive them as a therapy, but a patient whose tumor is progressing on steroid may be different. And in fact, there is a body of evidence now being generated suggesting that in particular settings, which we have not fully identified clinically, corticosteroids may contribute to tumor growth.